We all know the 3 numbers to call in case of an emergency, but the number to get help in a mental crisis isn't as easy to remember. Next week, that changes with the rollout of 988. Madeleine Hagen has the details.
911 is about response. 988 is about support.
On July 16th, these 3 numbers will get you help in a mental health crisis. 988 will not replace the suicide lifeline already in place, but rather make it easier to remember.
For people that are in a stage of stress, it's hard to think and do tasks. It's just going to provide a huge ability for people to access care and help and someone to talk to when they need it most instead of having to wait.
A 2020 study in Washington State found over 60,000 calls were made to crisis helplines. Chelsea Clicker with Lutheran Community Services Northwest says sometimes all you need is that reassuring voice on the other end.
They're the first step to maybe somebody finding the thing that's going to change everything, right? Oftentimes we just need that one person to step into our life and give us hope to keep going.
The 988 rollout comes as a part of House Bill 1477, which lays out the details for a mental health line in Washington. In the state, there will be 3 agencies that handle calls depending on your region. Volunteers of America is one of those agencies. Levi Van Dyke says that bill has helped prepare them for an influx of callers.
To basically increase funding to local crisis contact centers and then make sure that we can increase staffing to meet potential volume increases.
Levi says you can call the line for yourself or someone else.
A line for mental well-being. Someone doesn't have to be actively suicidal or experiencing suicide ideation to contact that line.
The people answering the phones are trained to help callers and connect them to local services if needed. But with statewide staffing shortages and less bed capacity, will we have the resources available?
But we can't let those risks stop us from taking those steps forward. So I think regardless, this is a fantastic step forward.
I think this is the first step for mental health in Washington and helping to, build a more robust and comprehensive crisis care continuum.
For Cap KVU Local News, I'm Madeleine Hagen.
Now, 988 will not be active until Saturday, July 16th. Until then, you still need to use the 1-800 number to get mental health support.